Welcome to Fit Chat, Chit Chat. I'm your hostess, Devondrea Sanchez, also known as the Fit Therapist, founder, owner, and client of Finding Inner Transformation, where we believe a fit mindset is more than the physical, but it is emotional, mental, and most importantly, it is spiritual. I am so thankful for my guests today. I'm going to have them introduce themselves in just a moment. If you're joining us live, I'm going to ask for you to put your comments, your questions, and your feedback in the live comment chat so we can answer them accordingly. If you're watching this in a recording, we welcome you to do the same thing. Put your comments and your feedback and your questions, and we'll get it to the right person to answer. And so I'm thankful to today's topic on mental health awareness. This is Mental Health Awareness Month. May is. And we know that mental health is important. We know that taking care of yourself and others is important. And we are hopeful that we provide some support and some questions and some answers to what has been lingering around in your mind. So I am going to start and let my panelists, who were so just open and willing to be here today, so I'm thankful for that, I will let them introduce themselves, talk about how long they've been in practice or anything that they would like to share, and then we will begin our show. And so we will start with Mr. Derek Brown.
Yes, thanks, Devondrea. I appreciate you for having me here today. So I'm Derek Brown, licensed clinical social worker. I've been in private practice, solo practice for almost 2.5 years. Also work at the Department of Veterans Affairs. I've been doing that for 7 years, working with the veteran population. Currently working around suicide prevention. What really brought me to the mental health was just, life experiences. In every course, they asked the question, why did you choose this field? And pretty much everyone said, it chose me. I didn't choose it. So, that's why I'm here today. And thank you for having me.
Absolutely. Thank you. And good day.
I appreciate that. I feel like I'm going to piggyback off of you, Derek. However, good day, Maza. I've been in the mental health field for 15 years, give or take, on different levels. I've been in practice 5 years, and out of that 5 years, I've been on in my own private practice the last 2 years. And what brought me to therapy? I feel like that's it's a loaded question. I think what brought me to therapy is experiences in and outside of my community and this level of understanding that I made it out. And that I have a bit of sense about how to make it out of situations. And I keep getting led right back to this process of therapy. No matter how I leave, I get back to it. So
yeah. That's awesome. Thank you. Good day. Miss Anna.
Hello, my name is Anna Soto, and I am a licensed clinical social worker. I've been a therapist since 2013. I currently work for a local hospital as a therapist in an outpatient clinic, and I've been doing private practice as well for the last 2 years. What brought me to therapy was that I went to therapy and I saw a huge need for mental health services. It was really accidental because I didn't want to be a therapist when I was going to school, and kind of just landed on my lap. And I've been doing it ever since and recognized the need in our community and the need for individuals to have mental wellness. And I quite enjoy the work that I do and the people I work with.
Thank you.
Thank you for having me on.
Absolutely. And I feel the need to then explain why I'm here then. So I have been in the mental health field for about 21, 22 years in different capacities. So I came straight out of undergraduate school into inpatient mental health. I do not advise any student to do that, any person to do that, for various reasons that we won't get into today. I have worked government and school-based therapy, and currently I do corporate wellness. So the majority of my practice now is healing collectively. And at an organizational level, being able to say that, your colleague may not just be acting out of their own might. It may be some other trauma It may be some other behaviors or experiences that are impacting the way that they show up every day. And so to normalize it from a corporate level really minimizes some of the stigma, because we recognize that they're no different. Yes, they're wearing the employee hat, but experiences still show up. And so that's my journey. And then, of course, running this platform that I love to do. I don't get to do it as much as I thought I would at the beginning, but ensuring that I make time for people like Derek G'day and Anna to be on today just to share their experiences and their education and knowledge. I feel like Derek and G'day is like the field chose me. It sounds all cliche, but it's real. And if you ever think, and this goes to the people watching, whether today or later on, if you think therapists don't have stuff, well, therapists see therapists, just as doctors see doctors. And I have never heard of a doctor performing his own surgery unless he's on like Gilligan's Island or something, okay? Otherwise, they need help too. And yeah, I got that, Derek. I picked back up on G'day saying, I made it out. That's so beautiful. And I'm sure we'll get around to digging into that a little bit more. With that being said, there are people on here today that have either misinterpreted or misconstrued mental health and what that means. Actually, even the word mental health makes some people's skin crawl. Now, mind you, we didn't say mental illness or mental dis-ease, just even the word mental health. And so just in your very, just your own knowledge or your own understanding of mental health, what does that mean to you? And I'm going to pose that question starting off with Anna, just what does mental health even mean to you? So we can give our listeners some context.
Well, first, I think I agree with you. There's so much stigma around the word mental. If you want to insult someone, just tell them they're mental, right? So going to the health of it is something that we don't prioritize. And sometimes in general, we don't prioritize our own health in general, but mental health is definitely put in the back burner. Yet our mind, and it's one of the most important things we have. So we should be prioritizing it and taking care of it so we can do everything else in our day-to-day effectively.
Yeah, that's good. You make a valid point how just words, right, can be taken out of context. When we say mental, and then you used it in a way that I have heard it derogatory, right? There's certain things that have changed over the course of years, starting with disabilities or special needs or special education, or the word idiot wasn't, at one point was used more formally, and then people took that, and then mental retardation, and then people took that, right? And then we keep trying to change it to make it more land softly on the ears. And so I'm glad you brought that up. G'day, what does that mean for you when you hear mental health?
So for me, words come up, and that's kind of how I function. So I think life, I think community, and I think how do we become available for those things that are requirements? You know what I'm saying? If we don't, like the old folks will say, get it together physically, get it together emotionally, get it together socially. So for me, it's also about availability, because again, the world requires a lot of us, and it requires us to be available. So that's what I think when I hear mental health.
Yeah, kind of like this broader spectrum of, I love the word requirement, right? And I was explaining to my kids recently, it's funny because, trying to get them to see futuristically, as a parent, you didn't ask me, oh, mom, you're sick, so let me not ask you for dinner. You 3, 4, 5, 6 years old, you still have requirements that need to be met for me, no matter how my mental, emotional, or physical shows up. And there were some days I wasn't well, but there was a requirement of me, both mentally, physically, and emotionally. So I love that too. Derek, when you hear mental health, how do you explain that, or how does that show up for you, so that we can definitely get our listeners to get some context to that?
Right. And it's a loaded word, as you know, the other panelists are really suggesting here. And I think a lot of it is rooted in our cultural beliefs, where we grew up, our religious beliefs. And so I think it's a much broader term than sometimes we don't allow ourselves to really unpack what it means. And for me, it just really means this ability to have awareness of one's internal state, right? And so much of our internal state, though, is affected by other people's opinions of us. And so that, when we can get past that and really focus on, those tools that we can utilize to focus on our own internal state, we can kind of overcome and adapt to situations. But it's an uphill battle for sure, because it's not just this, this one part of the wellness wheel, if you will. And so, I think that oftentimes we hear mental health and it's like, well, get it together by yourself. Well, it's like, no, not get it together by yourself. It takes a community, right? And so I think that's really important to even have talks like this where we're vulnerable and we're even having conversations about mental health is important.
Yeah, that's good. Trying to, and Derek and I have just recently connected, which has been nice because we talked about that, trying to heal out of relationship. You can, even if you're talking about more intimate partnership. So when I hear certain people, saying that, oh, I'm patient, I'm this, I'm that, like, sis, let me see the data. I need you to be with somebody first. Can I talk to them and see how patient you is? It's easier to be that or say those things when you're isolated, but we know that we don't heal in isolation. And so it brings me back to something you said, Derek, about in community. And Gade, I think you spoke on that too. Why are certain communities culturally, certain ethnicities, and we all heard the term BIPOC, right? Is Black, Indigenous people of color. That came out of the Black Lives Matter movement, if I'm not mistaken. I haven't done a lot of research, but I believe that to be true. And why are these populations not showing up to therapy or getting the mental health treatment like other communities? And I'll start with you, Derek. Yeah.
Well, that's the first thing that pops up in my mind is this big term that we like to use in social work, intersectionality, right? So this idea that we all show up with these different roles and different ways that we identify ourselves. And so for me, especially specifically as an African-American veteran, right? Those are the two of the things that I show up and I identify with in the Christian male. So like each one of those groups has a different ideology or belief in which, how man should behave, what man should do. And I think there's this kind of underlying ideology of like stoicism that I think works against specifically the male coming to therapy. This idea that, I can kind of take care of my own, and this ideology that really works against us. But then it's interesting because it actually goes against, from a military perspective, it goes against what you're trained in a traditional sense. So in the military, we learn the battle buddy system. We learn to work together. In basic training, one of the first things that we do are team development courses, where we learn that, wow, we can solve these very complex problems together, right? I remember one time we had a wood plank, a barrel, and a rope, and they gave us the task conditions and standards that we needed to solve, and they set some limitations on us, and together we all were able to solve that. And so I think it's this idea that, we get away from these structures and these environments, and then when we come back into the civilian world, I think we are told something different, and it really goes against what we're really taught in terms of like being in the military. So I think there's this misconception that the military teaches us how to be this stoic individual that's like this soldier of fortune that goes out there by himself. But in all actuality, they don't really teach that. I just think that it's, one word that I hear a lot, so many from my veterans, is the word camaraderie, right? And trying to recreate that. And so I think that, again, if we can overcome this idea of stoicism that I think is perpetuated even in our society in music and entertainment, more men would likely feel more vulnerable to come and share their feelings and their thoughts.
That's good. So you hit on like couple layers, right? The veteran, the male, and just in general, what people bring to the table that could prevent them from actually accessing care. And so, G'day, I'm gonna touch base with you. What do you think, or what's your thoughts around why certain populations or communities, in particular the BIPOC community, people of color, do not seek treatment?
I'm with Derek. It's a tricky question because, I come from a perspective of community does its work. It's who tells the story of what mental health is. I think that's important. You know what I mean? For example, the Western world, the European philosophy of mental health is very individualized. You know what I mean? Like, come sit, I'm gonna take some notes, right? You're gonna sit in this chair, I'm gonna sit in this chair. It'll be about 50 minutes, et cetera, et cetera. Whereas I think if we look at the majority, right, when we talk about Black and brown folks, BIPOC communities, the work is happening. Barbershops, I mean, we hear about that all the time, like as Black men, you know what I mean? And I can't tell you how many times I've sat in the barbershop and been in conversation that has been intense, but it's been healing too. You know what I mean? So I think the work is happening. It's, again, it just goes back to me for, to this idea of who is defining what that work looks like. So that piece is there. And here's the thing, at least with my clients, we consistently and almost always are coming back to educating ourselves about what mental health is. A bulk of my sessions, it's about education. And then we get to, relief, as folks call it, or, decrease in symptoms, et cetera. So yeah, that's it.
That's good.
Yep.
That's good. I like that. Yeah, who's telling the story? Y'all catch that? Who's telling the story about mental health? I can go on a whole nother fit chat with that. So I'm gonna leave that one right there. But I think everybody got the concept of what you're saying. Anna, what's your thoughts, especially being a Latina woman who's doing the work?
Yeah, I think, the stigma is something that really keeps people from coming to therapy. Some of the things I hear often from the people I work with is first of all, is how is therapy going to help me? How are they going to help me with my problems?
Mm-hmm.
Right? There's that part of not knowing what therapy is about, how it works, and how it can be helpful. But then also, the stigma of, if I go to therapy, then that means I'm crazy. Then that means that I have problems, that I'm vulnerable, and I will no longer have validity in my community or in my family. Because if my family finds out that I'm going to therapy, then that means that I'm the problem. And especially when we're working with trauma in interpersonal issues in families, including my own, we think if I go to therapy first, then everybody's going to think that I'm the one with the problem.
Yeah.
Right. So there's some of that. I think another thing I hear very often when people come to therapy, one of the things that keeps them from going to therapy in our culture is they think if I start talking about this, then I'm going to fall apart. And I don't have time for that. I don't have time to fall apart. I don't have time to be crying and to be sad. I need to just pull through and get it done. Right? I need to keep it together and hold it together. So there's a huge fear that once we open the door, I won't be able to close it and go on. Just like other illnesses, I work for a hospital system, and often people don't want to go to the primary doctors because they don't want to know they're sick.
Yeah.
Once you tell me I'm sick, then I'm really going to be sick. And it's
Right.
very similar. It's very similar to mental illness and mental well-being. Another thing I hear often from people that I see in therapy who have seen other therapists that maybe they were not clinicians of color, they often say, those people don't understand me. They don't understand my culture. They
Mhm.
don't get me. And that's because often we don't speak the same language as our clients. And by language, I don't mean just speaking English or Spanish or their native language, but we are speaking in a way that doesn't make sense. We're speaking as therapists and clinicians the way that we learned at school. We're not presenting this knowledge in the way that makes sense to the average person. So,
Yeah.
all of those things keep people away, that their education level, and they think, I'm not going to be understood. But from a woman's perspective and from a working woman, I often hear, and I work with women with postpartum depression, and lately I've been seeing a lot of professional women who come to therapy, and one of the things that has kept them from therapy is that we will not understand that they don't have the luxury of just staying home and taking care of themselves.
Mhm.
I hear women say, well, my therapist said I needed to get 8 hours of sleep and that I
Mhm.
needed to eat healthy food, that I needed to go for a walk. But I have two jobs and I have a baby and I can't sleep 8 hours. And that's all she kept on telling me, that I needed to do those things. And I just couldn't. So that wasn't working for me.
Yeah.
So sometimes just coming to therapy is about having someone to hear you out, to validate your experience. And sometimes we need people that look like us and talk like us to validate that experience.
That's so good. Yeah, I agree. I think what happened for most of us, and I don't know, well, let me speak for myself, is you mentioned just coming out of and talking like school. I don't know if there was a period of that, and then I recognized that they didn't care who psychoanalytics, they didn't care about family systems. They're like, listen, sis, can you heal me? Can you help me understand what's going on with me? I've worked with a lot of veterans. Right now, I'm the veterans facilitator for Kings County, as well as other little mini jobs that I do. And I got to talk to my vets different than I talk to my 16-year-old clients. And so when I think about that, I have done some very amazing opportunities to have non-traditional therapy. I've done rap therapy. And I'm not, if people talking about wrap around service, no, I was dropping beats and lyrics and I got 2 CDs out. But that was a pilot program that I got to do. It's interesting. I ran into one of my old clients. I was like, you remember me, Miss D, on the MIC? And he was like, oh, what's up? The language matters. Words matter because they speak life or death. And so we have an opportunity to speak life to people, for people, over people. And I do, we got to also, if my friend was on here, shout out to other licensed clinical social workers. I'm an LMFT, but we have love. We cousins, sister, brothers. She would talk about the social determinants of mental health, access to care. And we can't not talk about that as providers, that we don't have the same, or some of our BIPOC community folks don't have the same access. They don't. And systems have been betraying some populations. And so, as much as I see a beautiful Latino woman that looks like me, or a Black male that can understand me, you in the system, you still part of the system. And how do we break those barriers? And I remember, you would think that a fellow sister would see me and be like, oh, yeah, I want to connect with her. But she was like, I'm not telling you none of my business because you're going to call over to CPS. And I'm like, sis, and you're not sis right now. And I had to
Mhm.
work at that trust and build that rapport. And one of the greatest things about therapy is the relationship. And every one of you know that. If I don't trust you, I don't connect with you, I'm either going to tell you what I want you to hear, depending on why I'm there, because they could have been referred for, from probation or parole or CPS or all these other mandates. or I'm on my fourth marriage, or I'm wondering why I can't shake what's going on with me. None of that will matter if we don't have a good working relationship. So I thank you all for mentioning that. I want to go to a question that says, oftentimes religious beliefs discourage mental health treatment. How are people supposed to respond under those situations? Okay, so at the beginning, I talked about religion, but I think we should speak to this because we recognize this is also a population and a belief system that many folks are coming from, or the cloth that are cut from. I'm gonna start with G'day. As you got the Last Supper in the background, we gotta let you speak to this.
Y'all see that?
I do, yes.
So this might be the therapist in me, but I love flipping questions back, because part of being in relationship with our folks is understanding, you know what I mean, like their worldview, which, by the way, for me is paramount. I take as much time as we need to understand one's experiences, why you do what you do. So I would ask, in terms of that question, I would ask, how are you already functioning in that system? Number one.
That's
Right?
good.
Let me hear your worldview, because based on that, there's a need that is being unmet. And I don't know about y'all, but I like to go deep. So my natural bent is to literally say, hey, let's get into your gutter and pull all the things out that you've done to do your best to survive.
Mhm.
You know what I mean? So that's how I take it. And then based on that person's, world experience, then we get into the depth of, okay, so you've done your best to survive. And as a matter of fact, the system has done its best to survive as well. So where is that, Derek speaks about that. Where's that intersectionality?
Mm-hmm. That's good.
Mm-hmm.
Derek looked like you was want to say tag me in, bruh. So I'm gonna let you jump in on there.
Tag in.
Oh yeah, I love this, and I can't help but do a little bit of self-disclosure on this one, because I had a situation happen to me as a client of a therapist. He was a psychologist in training at a VA when I first got back home, and then this individual psychologist, he's going through the CBT modules and working through some issues with me, and I thought to myself, when I learned about cognitive restructuring and reframing, I was like, man, I can use a scripture to reframe this thought. And this psychologist, who I'm not going to name here, told me, are you sure that's a good tool to use?
Mm-hmm.
And when he said that, it was when I decided I'm never working with you again. That ignited my fire to become that clinician that, like G'day is saying, I want to know more about how you use this protective factor, because that's exactly what it is, right? Whatever your belief system is a protective factor for you. And so we have to look at it in the context of a protective factor, but then as advocates, we have to provide that information to the field and help them to understand that this is a protective factor for these people. But I think some of the challenges we face with, presenting religion or anything as a protective factor, I learned this very early on in the Army. There's two things that you don't talk about. You don't talk about religion, you don't talk about politics. Well, when you don't talk about religion and you don't talk about politics, what you're doing sometimes is you're disconnecting that person from a part of their identity. And so when they're not able to speak about their beliefs, then essentially what that's doing is that's cutting off a whole portion of the wellness wheel. Not just the spiritual side of it, but the social implications of that wellness wheel. What if my grandmother introduced me to religion? What if my grandfather introduced me to politics? And so we have to be very careful and not to try to cut out people's belief systems and thought patterns, because that essentially can be, again, a protective factor for them. And as we know, protective factors are what mitigates the risk of suicide when one is dealing with, several risk factors throughout their life, especially someone from the African American, Hispanic, or Latino community that may be that's subjected to all these risk factors. And so I always look at and say, how is this community so resilient? And a lot of times they have the church, they have the synagogue, or wherever it is that they worship, this sense of community and connectedness. So, as you can see, I'm very passionate about, about this topic. And I think that we have to lead the discussion, and we can't allow those people that, continue to perpetuate, their own thought process or ideology to control the narrative.
Ooh, listen, that's a whole nother Oprah show. I'm gonna have to bring that back around because I seen you went there. Alita says, yes, I did this with the client the other day. If you want to expand on what you did with the client, because we start rolling kind of quick. I want to make sure you did the open space versus the cut down. So put it in the chat so we can speak to that, Ali. Anna, what's your thoughts around that? So the original question was, oftentimes religious belief discourage mental health treatment. How are people supposed to respond under those situations?
Well, what I do when I'm working with someone who does have those challenges is I want to know what those beliefs are. And then I'm going to use my clinical skills, like Derek said, and using some cognitive reframing. In other words, I want to be able to see from that perspective where they're coming from, why they're reluctant. And often I'm not that familiar with so much scripture, but people often educate you on what their beliefs are, and you can use that to help them understand how this is the strength. And I find myself telling the people I work with sometimes, say, what does God want for you?
That's good.
And often, yeah, I have never had anyone tell me, well, God doesn't want me to be happy.
Mm-hmm.
And even when people come to therapy and they say, well, God is punishing me for something I did, then let's go there. What is it that you did to cause this? And then exploring all of that and helping people look at things from a different perspective using their own sets of beliefs, because I'm not going to convince no one that God is not punishing them. But if a church structure or a religious structure discourages you from seeking your own mental health, then you might want to find out what are the basis for that.
Yeah.
And then educate yourself what is therapy really about. In finding a therapist, there are a lot of faith-based therapists, or you can find a therapist that will be open to work with you. And you can bring that to the table from the get-go. I've had somebody during my first assessment ask me, do you pray during therapy sessions? And I was very honest about it. And then I asked what that person would like to do. And I will support what they like to do.
That's beautiful. Yeah, sometimes it is just providing support. And it's interesting. Anna and I worked with a mutual client. She had to end, and the case got transferred to me. And I can remember the client saying exactly what you said. She was very open with me that she didn't understand my religious belief. However, she gave me the space. And that's more important than anything. And that goes back to that therapeutic relationship. And so I can validate and confirm that that is you, and had an opportunity where I am able to work with the scripture and prayer and do all of that. And when challenged, really be able to not, on the religious side of it, you can get quickly tangled with scripture and interpreting it to fit that sense of belief, even if it is a little distorted. And so there is times where if you are a little more knowledgeable and have discernment about scripture, that you're able to bring that into the session. And I've had clients, and we've prayed. I've had clients where we've, talked about scripture. I've had clients who wanted to know my religious belief and background. And I've had clients say, I'm atheist or whatever however they identify. And we could take all of that in session. And so I'm glad to know that the church seems like they're getting more open and receptive about mental health. That's not something we were taught growing up, at least for me. Pray about it, take it to Jesus. Maybe you ain't praying enough. And that can really really challenge how you identify with the higher power or whatever you decide to believe in. And so I'm thankful that even at the end of this month, I'm speaking to a church about mental health and the African American community, and more in particular. You know, we jokingly will say you can have Jesus and a therapist. I believe that. And I do believe that there are belief systems in place that have been conditioned, and they knew what they knew, when especially certain populations, when that's all they had was song and scripture and prayer. So then this new age mental health, there's certain countries still don't. Mental illness, what's that? My friend, well, one of my old professors, who she was very open, and she was from oh my goodness, um somewhere in the Caribbean, wherever it was. And she said, her mom said, people pay you to talk? Like, there's no way people pay you to talk. And they didn't get that concept. Anna, I'm sure you're very familiar about curanderas, right? This is a different application. For some cultures, mental dis-ease is a form of a curse, is a sickness in the body. They don't identify it as that. And I honestly, as a therapist, jokingly, I don't like labels. I would say, what behavior or thought pattern is getting in the way of you being your optimal self? And that's what we're going to work on. So Allie gave some more context to the question. She goes, the client was reflecting on how they have begun using spirituality to reflect her negative thoughts to positive. It was not necessarily religion, but looking into what is out there beyond earth. Opposite in a way, but I gave the client the space to talk through it. Beautiful. Because we don't know all religion. And just because you may be a Christian, they're a Christian, they're Muslim, you're whatever that is, don't mean you are in the same relationship with that higher being. So we got to be careful, just to leave space to kind of learn from the client. So I totally honor everyone's answer. With that being said, you mentioned cognitive behavioral therapy. There's a big wave right now on somatic experiencing, especially when we're talking about trauma. I think earlier, before we got on, I was talking to Gade about movement, and that is something that I will prescribe, because I wrote, if we're having a systems disruption, neurotransmitters are not talking the way they should, we're not getting enough, serotonin, or we getting too much dopamine, so that's shutting down other areas of the brain. And trust me, I'm not no neurologist, so y'all don't even. I know front, middle, end, bottom part of the brain. Okay. So don't be sitting up in here talking about synopsis and all that. Now, I got a general idea, but listen, we ain't even going there because y'all don't care either. Okay, now that I got back to reality. However, I do recognize that in trauma or high anxiety, that front part of the brain may not adhere all of the fundamentals or the conversation to talk therapy. And I will also say that not everyone is trained in trauma, not all therapists, just like all therapists are not trained in understanding, the physical health, just like all doctors are not, going to know about the brain. Not all doctors are going to know about the hip. There's specialties. And so I want to know, is there a specialty that you all have, or a certain treatment that is your go-to? And again, I use eclectic. People say, most therapists, just for those that are listening, have a foundation, or at least they should. And then they may have tentacles out into different things. So I often hear some therapists on cognitive behavioral therapy, but I will use solution focused interventions. Is there a go-to population? Let me say that. Do you have a niche? Do you have a population that you work mostly with? And I heard Anna when she said postpartum women. And is there a certain treatment that you use, whether that's your foundation or not? Anna, I'll start with you.
Well, I am a behavioralist. I like to start with that, meaning that I like focusing on skills and development of skills, because so many of that lack that. We don't know how to cope Our parents didn't know, they did the best that they could, and we learned from them or our environment, whoever we were around. So dialectical behavior therapy is one of my favorite interventions to use, because the four set of skills can be so helpful. Learning mindfulness, learning interpersonal effectiveness, distress tolerance, and emotional regulation can go a long way for all of us. And I do work a lot with trauma. I would say that trauma and life transitions are my niche. And those sets of skills can be very helpful when working with trauma and helping somebody prepare to start digging in into where these things are coming from. And then trauma focused cognitive behavior therapy is also very, very helpful for me. Somatic, bringing in, and then after that, I just bring in a little bit of everything. So I do like working with somatic experiences, because part of mindfulness is connecting with our body, recognizing what is happening physically, so we can come back to be present, but also to recognize triggers. So much of the work that we do is bringing people's awareness to what triggers an emotion, and then how do we regulate our body, our physical body, so we can come back to the present. I did a training a while back to be an integrative mental health practitioner, because I believe, like you, that movement and nutrition have a big part in our mental wellness, because our mind is connected to our body, so we must take care of it. And there's so much research that shows that what we eat does affect how we feel. So integrating a little bit of everything can be helpful, and it just depends on the people that are coming, what they're looking for, and what is going to be something that they're going to realistically be able to implement. Because we can be in therapy teaching someone skills, but if they're not able to implement them, but what they can do is to go for a walk every morning, then guess what? We're going to work on helping them implement that coping skill.
Absolutely. Child, listen, you throwing out a bunch of skills people ain't gonna do, just like telling them to eat a bunch of kale salad. You know dang well you rolling up in church's chicken for that fried okra. Okay, don't sit. Oh, dude, church is even still around. Anyway, you get the point. I get it. And I did become certified in that integrative nutrition with Dr. Leslie Korn, because that is, at least that's the person I went through. I mean, it's mind blowing to talk about food and gut and microbiome and deficiencies and micronutrients. I think oftentimes we forget that that is co-regulation with how we think. So yeah, that's awesome. So Anna, sounds like
yeah, and I think sometimes helping people understand that there are things about our physical body that can make us vulnerable. For us women also, but hormonal cycling to us can make a huge difference on how we feel. Yet we've been taught, well, oh, you feel that way because you're on your period, or you're PMSing.
Yeah.
But it's left at that. So how do we work with that? How do we validate that experience? And then how do we treat ourselves in that cycle so we can be more effective, so we can be more gentle with ourselves? So educating people to recognize what's happening in their body, and then to be gentle with their own body.
That's so good. That's another word that has been misused and thrown out in a negative way. And that is a very vulnerable time. And we are so thankful that the DSM finally recognized that this, premenstrual dysphoric disorder is real. People have gotten their life took. Okay, sorry. That's real. That is so real. Got it. But preparation tools and interventions and coping strategies are definitely helpful. Derek, where are you at? What's your jam? What is your go-to? Is there a certain population? I heard you mention the VA, experientially and professionally. What's your go-to?
Yeah, so, honestly, it's funny because I started off with this very just innocent question, I guess you will. When I was very young, I asked the question, why do people do what they do to hurt children? Right. So my my lens, if you will, a theoretic lens, is from this perspective of trauma and understanding I think our experiences are shaped on our narratives. And so what I try to do, and going back to what you were saying, Devondre, about this eclectic approach, is I try to, number one, help people to understand their trauma based on the developmental crises that they may or may not have resolved. And what I've come to find is, with the males that I work with in therapy, a lot of them are stuck in this identity versus role confusion, this phase where they're trying to be something that a replica of what society says that they're supposed to be, the prototypical, muscular African-American male. And then when you don't live up to that standard, then, you constantly are fighting for this, that identity. And so you see full grown man walking around with chains and earrings and trying to find themselves, and it's just this idea of understanding, why am I behaving like that? Why am I seeking for that? And so I'm really starting to find this niche, which is, helping males overcome rejection, right? Because I think that's the root of a lot of the behavior that we're seeing. And so when you then start thinking about rejection and you start dissecting that, you go right back to the first stage of development, which is trust versus mistrust. So it's really about really helping people. And then you start to see, the eating disorders and things like that. All of that, in my opinion, starts very early on in development. And so helping people from a bottom-up approach first, if you see that they're there, helping them deal with that real visceral emotion that happens when someone, and I literally just discovered this in session. The most powerful 2 words in the English language are no, right? 2 letters, no. A person that hears the word no automatically may feel that, especially if they've dealt with rejection in their life, that no will trigger rejection in them. And so helping your clients to understand, what are these trigger words for you that are going to get that visceral emotional response. And then once they know, and then they have those tools to be able to restructure that, then they can sort of identify the emotion of rejection and realize that, and not personalize it all the time, right? Just because someone says no to you doesn't necessarily mean that they're against you, that that they don't want you to succeed. But I think sometimes we have to acknowledge, especially in some of our communities, that, no from a woman could very well take me back to that rejection of that mother that was never there for me, or that, whatever experience. And so that's what I've really, to be honest with you, have learned so much from my clients in session, this idea of like parallel processing, where it's like, wow, did I just hear them say that? And as you see, you hear them say these things and you're documenting, it's like, wow, like they just said that. But it's providing that space for them to sort of speak their narrative. But it's first, how do I get them to get past that real visceral emotion that happens, that anger, to be honest with you, that almost is instantaneous right when I feel sad. So right when I feel sadness or rejection, anger is like literally right there. And so in session, it's really powerful to help people really make that shift and say, I just heard you say this, and I think that it might have triggered that anger response. Let's go deeper underneath the iceberg and let's examine the feelings of rejection. And so I think, it really is about, and I know it's a cliche, but it's about meeting people right where they are in their development. And when you can do that, and you have this person and environment lens by which you look at behavior, you're really able to really design an intervention that's tailor-made for that specific individual.
Oh, that's good. Yeah, I like that too. That's really good. Learning from your clients while in session. Y'all don't even know, as clinicians, we do. As clinicians, we learn from our clients. I'm going to speak for everybody on that. There has not been one clinician that I've talked to that did not learn something about themselves. Good day. What is your fundamental foundation or population, if there is one?
I feel like Derek summed it up for me. I'm gonna drop my hand on that. I'm a depth union narrative based therapist. That's my heart. That's my core. And what I've learned from my clients is when we give them that level of permission to go there, they go there.
Yeah.
And what I've also started to find out is as long as the space is available, you know what I mean? Because there's something real about creating a container for folks
Mm-hmm.
to be able to like look at their monsters or these monsters that they've been given. People get well, and not only do they get well, once I, we literally let them flush their stuff out, put it on the carpet. They the triggers that they've experienced, they start talking about them triggers without any kind of, any kind of prompting, at least from my experience.
Mm-hmm.
So I just let folks get it out. We go to the gutter, and once we go to the gutter and it's out there and that relief is there, then we start talking about cognitive behavioral therapy, right? Like, and the way I break it down, at least to my clients, is you got this castle that you built on the outside. You know what I'm saying? It's got its lake, it's got its pitchforks, it's got its fire, it's got everything that you can imagine. You can keep all that. And not only can you keep all that, but I'm sure it works. That kind of protection or survival works in instances. So I go there. I go there deep. And a little bit of everybody, but my focus in terms of population is Black men from all, cloths of life and ages, young boys, young Black men and boys, which, it's interesting for me because folks don't give us as Black men enough credit to understand that we are deeper than what the world presents. So, I get a lot of pushback about this depth and philosophy. How do you go there? And I'm like, because my boys are, they're given the past permission, but they're also reminded that they're capable.
Yeah.
You know what I mean? So,
yeah.
Yep.
That's good. I recognize we have about 7.5 minutes, and we need a whole another 2 hours, really and truly. I do want to get to one last question before I do. I just want to say, I thought I had a niche or population, but I recognized all people are my people. And I didn't know that until in this situation, God was presenting different opportunities. Next thing I found myself speaking to firefighters, not having had that relationship, but I was connecting. I was connecting to registered nurses who were having a tough time, like any other parent with their child. I was connecting to military veterans. I was connecting to adolescent boys, Black, brown, whatever, with rap therapy. I was connecting to the Native Americans when I went out and learned equine therapy. I don't fool with no horses, y'all. If y'all know me, I don't do no animals. Okay. But I went there and I was able to connect. And that's what I'm hearing from every one of these clinicians is if it comes through my door, then we're going to go there. And we're going to do whether it's tailor-made intervention from a dialectical or cognitive or narrative. I just recently went through brain spotting a few months back. Woo, let me tell y'all, don't go unless you're ready. Because they take clinicians through too. And I was curled up like a baby on day 1, 2, and by day 3, I was back in the womb. Okay. And it cleared me out. Y'all don't even, my husband was like, I don't know what just happened, but I don't want none of that. I don't want that. But I did want that because I know that if my clients are experiencing this, wow, they getting free. Because what brain spotting, and I'm just a plug for brain spotting, which I thought I would never show up and do, it bypasses the front part of the brain and goes right into the middle where there's really no words. And I did go through one with 4 clinicians of color. So I did go through that first part with that. And it was a different experience. And we talked about some experiences that more than likely, I would go ahead and safely say that white people don't experience, because there is different experiences. There is different experiences. There is different systems in place. And Bruce Perry just really summed it up. I took a trauma and community healing training recently, and he said, when we say privilege, people get upset. And he used to get a lot of pushback. And he's very open. He's a white male, westernized thinking, a lot of, he said, but what privilege is really saying is that there was some systems in place in our history that allowed us to have more resiliency opportunities. And it's not saying, oh, because then he said he was getting pushback from, his white counterparts or friends saying, privilege, I had a hard life too. We're not saying that you didn't. What we're saying is there were systems put in place that allowed you to have resiliency opportunities far before you came. And let's just make that aware. Let's just become aware of that. We're not asking you to go march or do anything. Just become aware that there are certain systems that weren't in place for the BIPOC community that didn't allow resiliency opportunities. And when he broke that down, I was like, listen. And then there was a guy named David Ellis, I believe his name is, out of New Jersey. And I say this as well, and I think it was Derek that said, I meet people where they are. And I am that, and I'm sure we're all that, right? That's just basically saying, come with your raw, your uncut, as G'day say, bring your stuff, your pitchforks, your fire, your moon, your sun, whatever it is, bring that to session. And then he said something that I'm stealing. Shout out to David Ellis, if you ever hear this. He said, I want to meet people where they want to be, their ideal self, that image that you imagine yourself being, because you can't see that, right? But let me see that for you, and let's guide the session out. I was like, drop the mic. So I'm going to meet you where you are with the symbolism of that ideal self too, which is all goal setting, right? That's treatment. That's what we're doing, is really saying, I can see that you want to reduce anxiety 3 times a week, blah, blah, blah. I can see that for you, even though you can't see it, but there is something in you that can get a glimpse of that, because you set the goal. We didn't. So there's an idea that's there, and our job is to bring that out by the interventions, the coping strategies, the modalities, and all these other things. So that's absolutely beautiful. Last question, we're going to try to sum it up. I know we got a couple minutes. If you can stay on, stay on. If not, I understand, but I want to make sure we get to it, because I think this is important. What is it going to take for society to really take mental health as serious as physical health is? Or is it not financially lucrative yet? Let me just say one thing. Oh, it's lucrative. We know from a medical model, it's real lucrative, because you gonna listen. Don't open me up now. Hold on. We're gonna prescribe anxiety and antidepressant, anti-anxiety medication, antipsychotic medication, which we know most people don't stay at. You got to titrate up, or you're going to try another one. When we know there is research, I don't know what's starting to hit on that supports that physical fitness, them free feel-good hormones, them endorphins, you're going to feel good every time. There ain't no titrate up. And if you are titrating up, that's because your performance has gotten better, which speaks a whole nother lot of volumes to things. So I would put someone on Medicaid. I'm not saying there's no room for it, because trust and believe. I am not saying that some folks don't need a little hit of something, okay? But what I am saying, can you make that in combination to physical fitness? But we know, because some of those medications don't make you want to do nothing. Don't make you want to feel nothing, makes you overeat. So we know there's some lucrative money in mental health, but I think that is the problem, because it is so financially lucrative that it's easier for you to stay sick from a medical model perspective than it is for you to take care of your physical health. And I started going there. Nutrition, there's certain foods that inflame us, inflames our brain, inflames our body. Stress inflames our brain and our body. Depression does, anxiety does. And then we have these processed foods that inflame our brains and our bodies. Now you got a whole just walk in fire going there. But anyway, so speak to that real quick. I know we're a little bit over time, but can we just speak to what is it going to take for society to really take mental health as serious as physical health, or is it not financially lucrative? Anna, I see you. Go ahead.
Yeah, I think I'm going to be very simple. I think it's going to take for us individually to be accountable for our own health versus waiting for a system to do that for us. You know,
Mm,
we can't be waiting for the golden ticket. There's always that, like, well, if this was that, then I would be happy. If this happened, then I wouldn't be depressed. There is no golden ticket.
come on.
You just have to get it done. Just like physical exercise, there's no pill that is going to get you fit. There's no pill that's going to get you mentally fit.
Mm,
Medication does help, but you have to put in the work to be happy, to be well, to be healthy. And it's a combination of a lot of things. And most of the things that really work are simple things. They're not things that we can buy, they're things that we have to do.
come on.
So what it's going to take in my view is for us individually to put in the work to create change within us, and then help our family, then help our community, then help our greater society. But it has to start with you.
Ooh, accountability. Drop the mic. Thank you.
Mm-hmm.
Thank you. Good day. What is it going? What is it going to take?
I think Miss Anna said it. As cliche as it sounds, it has to start with us internally, because that's what our world is about before we see it on the outside. So
Yeah,
that's it.
that's it. Thank you, Derek. You want to add to that?
I'm going to piggyback on what my colleagues are saying. Same thing. I think it starts with from within. You know, this idea. You know, as controversial as Freud was, one thing that I do take from him is he talked about the pain pleasure principle, right? And Nike has got it well. They sat around the table and they were brilliant. Their marketing team said, "Let's create a slogan that with a check mark that says just do it," right?
Mm-hmm.
It's not about how you feel. It's not about what you've been through. And I think that's one thing from the military that I really appreciate, that I take away from that, is that at times we might say, suck it up and drive on is the wrong thing to say to someone. But at moments in life, there's logistics and then there's feelings, right? And so certain points, there's things that just have to get done in order for those, you know, for your needs to be met. And so you just have to have the mindset. And that's where we come back to mental health, is having that mindset that says, even though I don't feel like doing it, I know I have to do it. And that in and of itself is just a shift in the mindset. And so it really does start with us.
That's so beautiful. And again, we could go in. I know they are being courteous and keeping it short and sweet, but I know we could go in just in that statement alone, the medical model versus the wellness model. I see these folks here as wellness clinicians. Not all are. Let me just tell you that. Some are going straight to medicine. I can remember real quick, I remember telling this parent, and I had to give diagnosis of ADHD, and she wanted medicine because her family member seen how it slowed down their cousin, sister, friend, nephew. And so she wanted that as well. And I really wanted her to work with some behavior strategies and learn some concepts, because medicine is just going to, you know, slow the brain down. And I was just trying to educate her around that, but she wanted it, went to the primary care, got it. And she said, you know, excuse my Francais. She goes, he's still calling me a B. I said, it just slowed him down to call you a B. It wasn't going to take away calling you a B. So we got this thing that we believe that medicine is going to do, but it is not set up for that. I don't care which one it is. If you don't learn tangible coping skills, practical things that you can do. And as Gade said, you got to go, you know, you got to go in, right? If you don't learn those things, I don't care what medicine you're on or anything else, it's not going to be effective. And it is going to require more of that thing, because then you think it's the thing, right? You never look at what part you play in it. And so this was all beautiful. I do want to do one roundtable about, if there was one thing that you would tell someone to do for their mental health, what would it be? If there was one thing, whether it's a coping skill, whether it's just a sound advice or recommendation, what would that be? What is one thing for those who are watching? Because it may be someone who may be scared to go to mental health, heard that mental health wasn't, you know, let's just keep it real, was demonic, heard that this, and in that, yep, Shonda says tools are essential. What is one thing that you would tell someone to do for their mental health? Anna, you're off mute, so I'm gonna start there with you.
I would say to be kind to yourself. Be kind to yourself. So if you have a negative thought about yourself, change it, reframe it to something to be kind. If you tell yourself, I'm so dumb, reframe it to something that's positive and it's nice and kind to yourself. You're just doing your best right now. That's all.
Yeah. That's beautiful, right? Treat yourself like you would your best friend. Some people call you because you give it out like nobody's business, but won't give it to yourself.
Mm-hmm.
Amen. Thank you. Derek, what would you tell someone to do, one thing for their mental health?
Well, I guess I'll reflect back on myself. The one thing I would seriously say do is sometimes just pause.
Mm,
If you don't know what else to do, just pause. Don't do anything. You know, that the beauty in pausing.
yeah. Thank you. We don't consider that oftentimes because I think we're a society of go, 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 and think you need to do something. But if you pause and slow down for a minute, you may be able to actually get some good thoughts, some good decision-making skills, right? Thank you, Derek. Good day. What would you tell folks?
I think Anna said it, and I remind folks of this consistently. We already are doing our best. I know there might be some arguments around what best looks like, but you're doing your best. And somewhere between surviving and thriving, which are two things that can live together. And I think oftentimes we're told, yo, don't survive, you can only thrive. You can pause, like Derek is saying. You can rest, and then make your move.
Yeah. And I love those because at the same time that we're given this recommendation to either pause, to be kind, give yourself grace, or survive and thrive and recognize they can coexist, is therapy looks different for everybody. And music some days is therapy, right? Connecting with a friend is sometimes therapy. Prayer is a therapy. Mindfulness is a therapy practice. And so if you are unfamiliar, but I will say this, at the very beginning, I put the suicide prevention hotline because that is real. I'm hopeful to do the next segment on athletes and college athletes and suicide, as the risk seems like it just keeps going up. I want to pay attention that there are people here to help. If you don't know where to go, if you have insurance, go on Psychology Today. If you don't have insurance, look at community mental health. It's a start. There's some warm lines out there where there's just people who have been trained to just hear you and to listen. If you're a veteran, there's several veteran connections out there. We have access more than we ever have in our life. And so there's telehealth, there is community health, there's private practice. I want to ask my panelists, if you can, hopefully the comment box is up, put your information in there in case they would like to get in touch with you. I want to thank my panelists for being on. Rich, I feel like this should have been a 2-hour segment, but I got it. And then maybe we'll have them come back and just kind of like do a part 2 where we can talk more specifically about whether it's treatment or whether it is recognizing some of the signs when you're not well and what you can do. And we want to be able to allow them to speak to some more specific things. So put your information in the chat if you can, if you have time. If not, I see Anna had to go. We can definitely put her information in. And so we just thank you for coming on. For those who are listening, we thank you for your input. And so my client asking me, can I survive and thrive? And we frame duality is real. Oh, that's good, right? You can allow them to coexist, just like you can be angry and sad at the same time. Oh man, I'm happy, or I'm happy it's the end of the school year. Man, I'm gonna miss my friends, right? We know that the emotions and things and situations can have twofold approaches, maybe even 3 at some point in time. All right. Is there any last words before we get off today? If for whatever reason you're not able to put your information in the comments, I can definitely update it a little bit later. Any last words for our folks? Anna.
Thank you for joining us, and it was a pleasure chatting with all of you.
Perfect. Thank you. Derek, any last words or comments?
No, I just want to say thank you for, having us. I think this is very important to have these conversations and these talks. It really will decrease the stigma when folks can see themselves in therapy. And just to add one more thing, a lot of times we aspire to be athletes and entertainers and don't realize that we can use our suffering as and truly, and I hope I can use this word in this space, we can monetize our suffering. We have a rich history and experience, and so we have to start looking at other avenues and ways to make money from a purely economic perspective. And so I think we, as a community, we have to start looking at, what did I go through? What are my experiences? And then begin to translate those experiences into, resources for ourselves and for our families. So,
and people do it every day.
Every day.
Today, any last words before we get off?
I think just reversing the roles. We as therapists need not only to take care of ourselves so that we can be available for our clients, but we need to have these sort of platforms where we keep it honest and real, because folks outside of our, preview are having these conversations already.
Yeah. Oh, that's good. Absolutely. Thank y'all for joining us. I am just thankful for my panelists' honesty and willingness and knowledge and expertise. And so it goes without saying that I'm truly humbled and honored to just be around really good, competent clinicians. I'm just going to be 100% honest, and I will leave that where that is at. Thank you all for joining Fit Chat Chit Chat. Stay tuned. The next one, I'm very hopeful, will be on college athletes and the rise of suicide, because it is real and it's happening, whether we want to turn a blind eye to it or not. And so I'm hopeful to get some athletes on here, their parents, and a couple coaches, so we can talk about what is going on and these pressures that are being put on young kids at such an early age. And if you would like to be on Fit Chat Chit Chat, you have a story to tell or something you would like to share, email me at fitchatchitchat@gmail.com. My social media platforms on Instagram, Facebook, and YouTube is Fit Therapist. We thank you all for joining us. God bless you and take care. Bye.
Bye.